Today, we're going to be talking about muscle health, physical therapy, and exercise. My name is Lott, and joining me is Claudia Senesac, who will also be presenting. There are no published guidelines provided for people with Becker muscular dystrophy, or BMD, when it comes to specifics for exercise, but there are some general guidelines for people with Duchenne muscular dystrophy, or DMD. There has been increasing amounts of research for exercise in various forms of muscular dystrophy, with a few studies involving participants with BMD. However, there remains a great deal still to be done regarding the investigation of optimal exercise and activity for those with BMD. We will be discussing some general principles for exercise and activity, muscle health, and some thoughts on how to best implement them into your daily life and activities. Claudia will also provide some specifics for exercises. The American College of Sports Medicine has a vision and global health initiative of Exercise is Medicine, or EIM, for the general population. The concept of EIM encourages physicians and other healthcare providers to include physical activity when designing treatment plans and to refer patients to evidence-based exercise programs and qualified exercise professionals. Recommendations emphasize that moving more and sitting less will benefit nearly everyone. Individuals performing the least physical activity benefit most by even modest increases in physical activity. Additional benefits occur with more physical activity. Both aerobic and muscle strengthening physical activity are beneficial. Physical activity is defined as any bodily movement produced by the contraction of skeletal muscle that results in a substantial increase in energy expenditure. Exercise is one type of physical activity consisting of planned, structured, and repetitive bodily movement done to improve or maintain one or more components of physical fitness. There are different kinds of exercises, and we can see here 4 types of exercises listed. The top 2, cardiovascular or aerobic, and then strength or resistance kinds of exercises, are primarily based upon the energy system they use, with cardiovascular aerobic exercise dependent upon oxygen through breathing in order to have the energy sufficient to complete these types of activities and exercises that are a little longer duration. Strengthening or resistance kinds of activities are not dependent on oxygen and more of an anaerobic type of exercise, because the energy sources utilized are primarily those that are already within the muscle itself. Other kinds of exercises are flexibility and balance kinds of exercises that we will also be talking about later on. When we think of healthy or unaffected muscle tissue and strengthening exercise, we can think of this pictorial here of a part of muscle. This is a myofiber, or one of the muscle fibers themselves in the muscle. And you can see, if we look inside, a bunch of other smaller circles, these myofibrils inside. And for a healthy or unaffected muscle, when we have strengthening kinds of exercise and loading that occurs, this actually results in a very small amount of micro trauma or micro damage that can result in very small little tears in the muscle tissue. In unaffected muscle, this is not necessarily a bad result, because there are different kinds of cells that come to that area and repair it. And with this reparative process, not only is the muscle tissue able to function again and do well, but it actually gets larger or hypertrophies so that there's a greater capability of generating strength, or in essence, it gets stronger. When we look even further inside skeletal muscle tissue, we can see that within this smaller amount of tissue in the muscle fibers and the myofibrils, we see these proteins. So here at the muscle cell membrane, or sarcolemma, there is this dystrophin-associated complex, or a group of very important proteins. Inside the muscle, we have different kinds of components, such as actin, which is one of the sliding filaments that helps generate force. And between these, we have a key protein known as dystrophin. This protein dystrophin is what connects the intracellular matrix to the extracellular matrix for the cells. But in those with dystrophinopathy, like people with DMD and BMD, the amount and type of dystrophin is absent in those with DMD and impaired in people with Becker's or BMD. This lack of functional dystrophin makes dystrophic muscle more susceptible to muscle damage, which can lead to muscle wasting and resultant muscle weakness. So this is why it's very important when we're thinking about any kind of strengthening or resistance exercise or any kinds of exercise or activity to consider that there is a balance. If not enough type of exercise or activity is done, that can result in loss of muscle mass or muscle atrophy. However, if too much is done, it can result in muscle injury and other types of harm that could be done. And so it's really important when we think of individuals, in particular with neuromuscular disease and dystrophinopathy, that we think of this balance, but also that there are many other variables in play in order to better understand what is the best kind of exercise or activity prescription with individual consideration. And as mentioned, this is important for all patient populations, but is especially key for those with dystrophinopathy and muscles that are more fragile. A recent article was published looking at current and emerging therapies in BMD. And one statement that was made in that article was that to obtain a long survival, it is of crucial importance that patients with BMD stay in shape and continue to use their muscles. This is important and can be thought of as well as that exercise for those with BMD, while it's not going to cure the disease itself, it is still very key to maintaining optimal health. And also to remember that movement of any kind can be beneficial if done in a safe manner. When we think of muscle contractions, there's three types that I'm going to mention. In the upper right-hand corner, we have what is known as an isometric contraction. This is a type of muscle contraction where the muscle contracts, but they do not shorten. There is no resultant movement. So here in this pictorial, the individual is contracting the muscles, but there's no movement of the weight. You can also think of that as you're pushing against a wall, where even though you're pushing and the muscles are working, there is no movement that is occurring. Another type of contraction is concentric contraction. This is where the muscle contracts and shortens, and it causes movement. Here, a movement that results in the weight being lifted up towards the shoulder. There's also eccentric contractions. These contractions are when the muscle contracts and lengthen, and they're done primarily when we're lowering some kind of weight, such as is seen in the pictorial. We can think of these kinds of contractions that also occur when we're going downstairs and having to lower our body weight as we step down, or as we lower ourselves from a standing position to a seating position. While these kind of eccentric contractions do happen in our normal everyday movements, it is important that these kinds of eccentric contractions are not done with high amounts of weight or a lot of repetition, as these are known to result in more likely risk of muscle damage. We had actually recently done an isometric strengthening exercise program in some individuals with dystrophinopathy. These were ambulatory boys with Duchenne muscular dystrophy, and we had them do exercise, again, with no movement, where they were kicking up or pushing against the resistance that didn't move, or pulling back and bending the knee, again, with no movement, but working those muscles. And we had them do this exercise program at home with some equipment that we provided them. And then we supervised the exercise, providing feedback as well as instructions, ensuring care was done for the exercise sessions. This was done for 12 weeks that these boys did this exercise. After this exercise program of isometric strengthening, there were some good results that we had, in that on the far left, from a safety aspect, we saw that these boys were able to complete this exercise program without any increased inflammation, which we assessed via MRI. We also saw that these boys had improvements in strength of the muscles that were exercised, as well as improvements in functional ability when we looked at how we timed them going up and in particularly downstairs, looking at a common time functional test. While this kind of isometric strengthening exercise program did have beneficial results, of course, it does require some sophisticated and rather expensive equipment. And so I'm not recommending that you go out and purchase some special expensive equipment, but keep in mind that isometric exercise may be a very safe and good way to do exercise for those with dystrophinopathy. And there are many different ways that these kinds of exercises can be done. Claudia will be discussing these more in her portion of the presentation. For resistance and strength exercise, there was a study done where they looked at strength training, looking at both low intensity and high intensity kinds of resistance exercise. This study involved people not only with Becker's muscular dystrophy, but also limb-girdle muscular dystrophy. And those in the low-intensity group did exercise for 6 months, while those in the high-intensity did exercise for 3 months. And the exercise were both for the arms and the legs. Those in the low-intensity group, all of the individuals completed the study being very compliant and demonstrated improvements in strength and endurance for muscle performance. And interestingly and importantly, there were no changes in creatine kinase, so no indications of muscle damage. In the high-intensity group, only 2/3 of the participants were able to complete the study, and the improvements were more variable. And one of the subjects who dropped out actually did have elevated creatine kinase levels. Well, from this kind of message, we see that while these individuals were able to go ahead and complete exercise based upon this kind of resistance and strengthening, it's important to keep in mind that the low intensity is something to be a more important consideration in looking at resistance exercise. And if doing some type of exercise, to ensure that it is supervised and that there's clear communication with the health care team to avoid any risk of injury. The same group also did a study looking at aerobic exercise using cycling, and this was in individuals with Becker's muscular dystrophy. Individuals did cycling for 12 weeks, and some of them went as long as 1 year of duration doing moderate intensity cycling. And at the end, all of these individuals showed improvements in their cardiovascular fitness, the strength of the muscles for the cycling components of the legs, as well as being able to have an increase in workload. And none of them had any indication of muscle damage. The results demonstrate that this kind of cycling exercise at a moderate intensity can be a very safe method to increase exercise performance and daily function in patients with BMD, suggesting it to be a useful approach for rehabilitation. So when we're thinking of aerobic exercise, it is important to keep in mind the intensity that one utilizes. And the intensity should be more at a moderate to light kind of intensity. One way of assessing that you can do on your own is utilizing what is known as a talk test. While the talk test does not require any equipment, it has been validated with other kinds of more sophisticated equipment in clinical research labs. For the talk test, while doing an activity, if you are able to both talk and sing while doing that aerobic exercise, then that can be considered being done at a light intensity. If you increase that intensity to the point where you can still talk, but you can no longer sing because of more breathlessness, you're now at more of a moderate kind of intensity. And if you get to the point where you're no longer able to talk and you're no longer able to sing, that is a more vigorous intensity. And at that point, you should back off and again, keep it more at that moderate to light intensity level. Another form of exercise that's important is flexibility. With flexibility, this should be done for at least 2 to 3 days a week, where you're stretching the muscles to feeling the point of tightness or slight discomfort, but not going into any moderate or more severe pain, just slight tightness, maybe slight discomfort. Holding the stretches for 10 to 30 seconds with an overall volume of stretching for 60 seconds for each flexibility exercise you're doing. Important to keep in mind that flexibility exercise is most effective when the muscle is warmed through light to moderate aerobic activity prior to initiating the flexibility exercises. And there are a few other points that I just want to make mention of when thinking about exercise. One is it's important to not exercise to exhaustion. If you're pushing yourself to the point of exhaustion, you are pushing yourself to the point where you're more likely to have muscle damage and injury. So while you might get a little tired doing exercise, do not go to exhaustion. Also, you should not have pain during exercise. If you're hurting during exercise, that is something that you're most likely causing more kinds of injury to yourself and the muscle tissue. Also along that same note is that you should not have anything more than any mild muscle soreness, and it should resolve by 24 hours after you've completed exercise. If it has not done so, you again have done too much exercise. Make sure while you're exercising that you're taking adequate rest breaks. This is not something to push through, and keep yourself hydrated. And when you're starting to exercise, the mantra is to start low and go slow. Don't push yourself in excess. Keep in mind this kind of mantra to decrease your risk of injury. For initiating an exercise program, Make sure that you speak with your physician before you start any new exercise program so they can provide input and keep you safe. They will likely talk to you about heart health, and they may have different kinds of evaluations to ensure that while you're working the muscles of your arms and legs, that your heart is also safe. Keep in mind, as you're looking online and talking to other individuals, that not all muscular dystrophies are the same. So what you may read or hear about other individuals with other types of muscular dystrophy doing exercise may not be applicable to you with Becker's muscular dystrophy. And keeping in mind that one individual with Becker's muscular dystrophy is not the same as someone else with BMD, and those individual characteristics and variables that are important to consider. And when you do exercise, find something that you enjoy, not something that's a labor-intensive chore to do, but something that you can incorporate in your lifestyle that you'll be able to do and have something for long-term compliance and success. And now Claudia is going to discuss some other specifics with regards to exercise.
Thank you, Donovan. I'm going to go over some exercise examples and some suggestions. Movement is exercise. Moving and participating are really important for your physical, emotional, and mental health. Most exercises can be modified and adapted for just about anyone to do and participate in. So I want to talk a little bit about preventions and precautions. The first thing is don't overdo it. Stay hydrated. And as Donovan said, you shouldn't have pain when you're exercising. If you feel pain while you're exercising, that means you should stop. If your muscles are sore greater than 24 hours after you've exercised, that means that you have overdone it during your exercise regime. If you note that you have dark or brown urine after exercise, this again is an indication that you've overdone it during your exercise and may indicate that you have rhabdomyolysis or rhabdo. You should contact your physician to follow up on this. Getting outside is good for your health. Sunlight boosts the body's ability to produce vitamin D and can help reduce anxiety, stress, and symptoms of depression. It can also help instill a calm, peace, and relaxation through the production of endorphins. It helps us restore our focus. It also gives us a break from the constant stimulation that we have throughout the day. Getting outside and getting fresh air for 15 or 20 minutes, 1 to 2 times a day, is a great idea and is really good for your health. Walking is a great exercise. If you're just starting out, go slow. Walking 3 to 4 times a week is a good exercise regime and a good routine to get into. Walking 15 to 20 minutes, even if you have to take rest breaks, is considered good exercise. Monitor your heart rate, monitor the distance that you go. And remember, as Donovan said, check with your doctor first before you start an exercise program. Make sure that you're in good health before you go out and start an exercise program. Set reasonable goals for yourself, but do set goals. You don't have to exercise every day, but setting up a routine and being consistent is good for your body and for your heart. Isometric exercise. Donovan talked about this. And remember that with an isometric exercise, the muscle is working. It's just not moving during this contraction. Over on the right-hand side of this slide, these are some arm exercises that are isometric. You can do them in standing or in a seated position. You can also do them in a wheelchair. So in this particular exercise here, this person is using their arm to push against the wall. This exercises the entire arm. Over on the right-hand side, we have an individual that has their arm bent at their side. The elbow is bent, and they're pushing their hand against the opening of a door or the door frame. If we go down from that on the right-hand side of the slide, this person is seated with their elbow bent and their arm either against the wall or the back of the chair or the back of the wheelchair, and they're pushing their arm back as the arrow is indicating into that chair or against the wall. If we look at this other figure, this person is standing, but could just as easily be seated. The elbow is bent and the arm is pushing either against the chair or against a wall. These are isometric exercises. If we look at this woman seated on a mat table, she's holding a ball between her knees. Again, she's squeezing the ball with her knees. This is an isometric exercise for the inner thighs. This person is seated in a chair and straightening her knee and holding it there. When we talk about doing these types of exercises, isometric exercises, we would like for you to do 6 repetitions of the exercise, hold each repetition for 5 seconds, and repeat those exercises for 4 sets of 6 repetitions. This last slide up in the left-hand side is an individual standing against the wall and slowly lowering themselves to a comfortable position where they can hold that position and hold it for 5 seconds and then repeat it for 6 repetitions. This is good strengthening for the quadriceps, the thigh muscles, making sure that the back is against the wall, the shoulders are back, and your posture is good. Select an area to focus on that's meaningful for you. You can pick your arms, you can select your legs, or you can work on your trunk. Set goals that are important for your body, for you as an individual. Consult with a physical therapist for guidance. And it's not important to do them every single day. Try to fit them into your routine, and that's usually 3 or 4 days a week. Pool exercises. You can do aerobic workouts in a swimming pool. You can also do strengthening workouts in a swimming pool, as well as isometrics. In the pool, you can work on agility, you can work on balance, cardiovascular fitness, flexibility, strength and endurance. You can even walk in the swimming pool. If we look in the upper right-hand corner of this slide, this person is working on standing balance on one leg. This is a balance activity. It's also a strengthening activity. If we look right below that, we see a series of 3 slides, 3 images. This individual is actually working on rolling side to side using a swim noodle to give themselves a little bit more lift in the water and just practicing that roll side to side. What's great about the water is it gives you more buoyancy, more lift. You may need some adaptive equipment. These are floats that you hold on to and give you just a little bit more buoyancy in the water. Of course, you can swim in the water or float on your back. In the upper left-hand corner, we see this individual doing a squat at the side of the pool, holding on to the side of the pool. This could be isometric, just squatting down and holding the position, or it could be more of an up and down in the water, letting the water help you so you don't have a lot of resistance. And the last image is the same individual holding on to the side of the pool and lifting their leg up and down, exercising the hip. Aerobic exercise can be cycling. And we have two images here of a recumbent type bike, stationary bike. What's great about these bikes is most of them are adjustable, so you can get the positioning just right for your body. You can also monitor your heart rate while you're on these bikes. You can exercise with your arms at your side, holding on to the armrest next to the seat, or you can extend your arms and hold on to the armrest that are in front of the bike. You want to start off with no resistance so that you're not putting too much stress on the muscle while you're cycling. Again, it's a good idea to consult a physical therapist for the appropriate fit of the recumbent bike and just to set some parameters for you getting started on your cycling. Over on the left-hand side of this slide are ergometers that can be used for leg or arm cycling. And what's great about these is you can place them under a chair or a table for exercising with your legs or in front of the wheelchair, or you can put them up on top of the table and use them with your arms for cycling. Both have been found to be very beneficial. And balance exercises. These are great for your core and your trunk. If we look at this individual in the left upper corner, he's sitting on a therapy ball. He's doing an isometric exercise with his arms, and he's working on his trunk. If we look right below that, we have an individual that's seated. He could easily be in a wheelchair and using the ball with his arms moving side to side, working on his trunk or his core muscles. If we go to the center, we're also working on balance across these three images, moving the ball out to the side, both arms overhead, and then out to the other side. Your arms, if they don't extend all the way overhead, or your arms are maybe not as strong as this person's, you don't have to extend all the way overhead. Work within what your abilities are. Right below that is a person sitting on a balance disc, again, working their core muscles. This can be done in a freestanding chair, or you could do this in your wheelchair. And then we have for the person that's ambulatory and would like a little bit more of a challenge, you can be walking through an obstacle course with cones, rings, swim noodles to step over. You can walk on level surfaces or in the grass for a more challenging walk, adapting to an uneven surface or stepping over low obstacles. And then dribbling a ball, working on weight shifting back and forth is good for your balance and your coordination. And then you could also add dribbling the ball through obstacles, going in and out of cones. In summary, exercise is important for your overall health. Consult your physician before you begin an exercise program. Consult with a physical therapist who is familiar with neuromuscular diseases, particularly Becker muscular dystrophy. This way, they can design an exercise program that is for you as an individual, specifically with recommendations for your situation. Start low and go slow. Every little bit counts. Choose activities that are meaningful for you, enjoyable to do, and fun. No matter how serious life gets, Remember to have fun and be silly, at least part of the time. Thank you so much.